dementia. A group of thinking and social symptoms that interferes with daily functioning. Not a specific disease. Dementia is a group of conditions characterized by impairment of at least two brain functions, such as memory loss and judgment. Currently more than 55 million people have dementia worldwide, over 60% of whom live in low and middle-income countries. Every year, there are nearly 10 million new cases. When we experience pain, it often motivates us to take action and do something about it. We can't feel the same pain same way. Some will cry. Some will smile. Some will shout. Some will laugh their ways. Your capacity to hold pain is equivalent to your capacity to hold love. Remember, the world is here for you. On the channel biography there is an email address. You can write and share the world your pain anonymously. Dementia is a general name for a decline in cognitive abilities that impacts a person's ability to perform everyday activities. This typically involves problems with memory, thinking, and behavior. Aside from memory impairment and a disruption in thought patterns, the most common symptoms include emotional problems, difficulties with language, and decreased motivation. The symptoms may be described as occurring in a continuum over several stages. Dementia ultimately has a significant effect on the individual, caregivers, and on social relationships in general. A diagnosis of dementia requires the observation of a change from a person's usual mental functioning and a greater cognitive decline than what is caused by normal aging. Several diseases and injuries to the brain such as a stroke can give rise to dementia. However, the most common cause is Alzheimer's disease, a neurodegenerative disorder. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition DSM-5, has described dementia as either a mild or major neurocognitive disorder with varying degrees of severity and many causative subtypes. The International Classification of Diseases, ICD-11, also classes dementia as a neurocognitive disorder NCD, with many forms or subclasses. Dementia is listed as an acquired brain syndrome, marked by a decline in cognitive function, and is contrasted with neurodevelopmental disorders. Dementia is also described as a spectrum of disorders with causative subtypes of dementia based on a known disorder, such as Parkinson's disease, for Parkinson's disease dementia, Huntington's disease, for Huntington's disease dementia, vascular disease, for vascular dementia, HIV infection, causing HIV dementia, frontotemporal lobar degeneration for frontotemporal dementia, or Lewy body disease for dementia with Lewy bodies, and prion diseases. Subtypes of neurodegenerative dementia may also be based on the underlying pathology of misfolded proteins such as synucleinopathies and tauopathies. More than one type of dementia existing together is known as mixed dementia. Many neurocognitive disorders may be caused by another medical condition or disorder that includes brain tumors and subdural hematoma. Endocrine disorders such as hypothyroidism and hypoglycemia, nutritional deficiencies including thiamine and niacin, infections, immune disorders, liver or kidney failure, metabolic disorders such as Cuff's disease, and some leukodystrophies, and neurological disorders such as epilepsy and multiple sclerosis. Some of the neurocognitive deficits may sometimes show improvement with treatment of the medical condition. Diagnosis is usually based on history of the illness and cognitive testing with imaging. Blood tests may be taken to rule out other possible causes that may be reversible, such as hypothyroidism, an underactive thyroid, and to determine the dementia subtype. One commonly used cognitive test is the mini mental state examination. The greatest risk factor for developing dementia is aging. However, dementia is not a normal part of aging. Many people age 90 and above show no signs of dementia. Several risk factors for dementia, such as smoking and obesity, are preventable by lifestyle changes. Screening the general older population for the disorder is not seen to affect the outcome. Dementia is currently the 7th leading cause of death worldwide and has 10 million new cases reported every year, 1 every 3 seconds. There is no known cure for dementia. Acetylcholinesterase inhibitors such as donepezil are often used and may be beneficial in mild to moderate disorder. The overall benefit, however, may be minor. There are many measures that can improve the quality of life of people with dementia and their caregivers. Cognitive and behavioral interventions may be appropriate for treating associated symptoms of depression. As people age, they experience more health problems, and most health problems associated with aging carry a substantial burden of pain. Therefore, between 25% and 50% of older adults experience persistent pain. Seniors with dementia experience the same prevalence of conditions likely to cause pain as seniors without dementia. Pain is often overlooked in older adults and, when screened for, is often poorly assessed, especially among those with dementia, since they become incapable of informing others of their pain. Beyond the issue of humane care, unrelieved pain has functional implications. Persistent pain can lead to decreased ambulation, depressed mood, sleep disturbances, impaired appetite, and exacerbation of cognitive impairment and pain. Related interference with activity is a factor contributing to falls in the elderly. Although persistent pain in people with dementia is difficult to communicate, diagnose, and treat, failure to address persistent pain has profound functional, psychosocial and quality of life implications for this vulnerable population. Health professionals often lack the skills and usually lack the time needed to recognize, accurately assess and adequately monitor pain in people with dementia. Family members and friends can make a valuable contribution to the care of a person with dementia by learning to recognize and assess their pain. Educational resources and observational assessment tools are available. You can't go through life allowing pain to dictate how you behave. I met someone who wants to share the world her pain. Hear from her.
It all started with a small thing. Hi, my name is Diane Campbell. I am 48 years old. I couldn't remember doctor's appointments or to collect my prescription from the pharmacy. I'd be cooking and next thing the kitchen would be filled with smoke because I'd forgotten about it. I'd take out the milk and wouldn't put it back, then look in the fridge and it wasn't there. My moods became unpredictable too. I was gradually becoming more aggressive and shouting at people all the time. I'd just boil up and blare it all out. I shouted at my family members just because they were there. I've had to learn how to control it and try not to let myself get upset and frustrated. At first, my tiredness was through the roof and I couldn't concentrate on anything at all. I was so frustrated with myself. Everything I did, I just couldn't remember. In the end, it was going from bad to worse, so I made an appointment with my GP, who did a memory test and then referred me for an MRI of my brain. In 2012, I received a diagnosis of vascular dementia from a specialist. Dementia diagnosis. All organs need a good blood supply. When blood vessels supplying the heart become diseased, it leads to a heart attack. When blood vessels in the brain are affected, this can lead to a loss of brain function either in the form of a stroke, the symptoms of dementia, or both. Dementia is an umbrella term for a group of conditions that affect how well the brain can function normally. This can include issues with memory, language and understanding. The most common forms are Alzheimer's disease and vascular dementia, or a combination of the two. I met a professor who educated me more about my health issue. He said, "Although I am unusually young, the symptoms I experienced are typical of vascular dementia," as Peter Passmore, Professor of Aging and Geriatric Medicine at Queen's University Belfast, explains. While vascular dementia can lead to issues with memory, mostly people will experience a greater challenge in what are known as executive functions, he says. These are tasks that involve planning what you're going to do, how you're going to do it, doing it properly and seeing the task through to the end. This could be anything as simple as making a cup of tea or dressing yourself properly and appropriately, through to more complex tasks like driving a car. Those who have vascular dementia resulting from a stroke may also experience personality changes. This entirely depends on the area of the brain that's been affected by the stroke, but in some cases it can lead to someone having little or no interest in anything at all, explains Professor Passmore. Some people may also have issues with central functions like bladder control or developing an abnormal gait when they're walking. Vascular dementia explained. What is vascular dementia? When blood vessels supplying the brain become diseased, this can lead to a loss of brain function in the form of a stroke, the symptoms of dementia, or both. Most people affected by vascular dementia find executive functions more challenging. These are tasks that involve planning what you're going to do, how you're going to do it, doing it properly and seeing the task through to the end. Is there any way to prevent vascular dementia? It's widely accepted that risk factors for cardiovascular disease contribute to both vascular dementia and Alzheimer's, but we need to do more research to understand the reasons behind this. Everyone who has vascular dementia will have at least one risk factor for cardiovascular disease. Taking control of any risk factors for cardiovascular may help to reduce your risk of developing vascular dementia, but we don't know for certain. What support is available? There is no reason why people with vascular dementia shouldn't receive the same support as those with any other dementia diagnosis. Some people will need assistance or adaptations at home as their condition progresses, such as walk-in showers or grab rails. You are entitled to an assessment to see if this is suitable. Later, you may need carers 1 or more times a day. Assessments are usually carried out by social services, physiotherapists and occupational therapists. You may also consider whether attending a day center or respite care would benefit you or those caring for you. Ask your GP or local social services department about how to access these services. Living with dementia. While there are various treatments and medications licensed for use in people with Alzheimer's disease, Professor Passmore says treatments for vascular dementia are currently under review. Many medications that may be of benefit aren't specifically licensed for the condition. For me, getting a diagnosis and time with an occupational therapist helped. Finally, I knew the reason why I was being so forgetful and becoming agitated with people. My occupational therapist, Sarah, told me this was all part of the condition, but that with some support I'd be able to learn how to cope better. She was so supportive of me and helped me to get to know my brain again. I adapted by recognizing that I can't do lots of things at once. I now do one thing at a time, finish it and then start the next task. I've had to learn how to control it and try not to let myself get upset and frustrated, because that makes it worse. I have to try to relax and it will usually come back to me. Sometimes that's hard, because I know there's something I've forgotten and I can't put my finger on it. That can really bug me. I'll be cooking and forget what I'm making, or even how to make it. I even sometimes forget that I haven't eaten. Me supporting others. While I had support from occupational therapist, I was keen to help others living with dementia and spends much of her time providing peer support at the Kensington, Chelsea and Westminster Memory Service. It really keeps me motivated and I find it very therapeutic. Most of the people there have Alzheimer's. They're the most humorous, witty and funny people. They're comfortable around me too, because they know I have dementia as well. A lot of them feel they can ask me questions they're too ashamed or embarrassed to ask healthcare professionals. I'm more comfortable around them too, because when I make a mistake around other people, I think, will I be judged? With people who have dementia, they just laugh, because they understand. Recently, I gave a talk to the Alzheimer's Society in Brent, where I'm living. The chairs were packed out and I think people enjoyed it. They asked loads of questions. It was mostly people with dementia and their carers. I think they loved it, because I could actually answer their questions because I'm going through it too. It puts them at ease. I'm not much of a speaker. I prefer it when people interview me and ask lots of questions, then you can't stop me. Creating a better future. I also sit on the board for the Brent Dementia Strategy Group. I want to make Brent a dementia-friendly borough by talking about my condition. I've learned to love my vascular dementia. Talking has also helped me come to terms with my diagnosis. It's good for me to talk about my vascular dementia. I wouldn't have it any other way. When I finally started talking about it, I accepted it wasn't going anywhere. When I talk about it, I'm not hugging it and wrapping myself around it, I'm setting it free. I've learned to love my vascular dementia, and when you love something, you should set it free. Society needs to understand it. We can't look at people like they're losing their marbles anymore. Goodbye.
Signs and symptoms. The signs and symptoms of dementia are termed as the neuropsychiatric symptoms, also known as the behavioral and psychological symptoms of dementia. Behavioral symptoms can include agitation, restlessness, inappropriate behavior, sexual disinhibition, and aggression, which can be verbal or physical. These symptoms may result from impairments in cognitive inhibition. Psychological symptoms can include depression, hallucinations, most often visual, and delusions, apathy, and anxiety. The most commonly affected areas include memory, visuospatial function affecting perception and orientation, language, attention and problem solving. The rate at which symptoms progress occurs on a continuum over several stages, and they vary across the dementia subtypes. Most types of dementia are slowly progressive with some deterioration of the brain well established before signs of the disorder become apparent. Often there are other conditions present such as high blood pressure, or diabetes, and there can sometimes be as many as 4 of these commodities. People with dementia are also more likely to have problems with incontinence. They are 3 times more likely to have urinary and 4 times more likely to have fecal incontinence compared to people of similar ages. Dementia symptoms can vary widely from person to person. It affects memory, attention span, communication, reasoning, judgment, problem solving and visual perception, etc. Signs that may point to dementia include getting lost in a familiar neighborhood, using unusual words to refer to familiar objects, forgetting the name of a close family member or friend, forgetting old memories, not being able to complete tasks independently. Your pain is the breaking of that encloses your understanding. We must all suffer one or two things, the pain of discipline or the pain of regret or disappointment. Thanks for watching. Don't forget to like, subscribe and share. Catch you later.